Good morning. My name is Bianca Ramirez, and I'm the new Executive Director for HCB. The purpose of this presentation is to show all of you, as the HCB Board of Directors, an overview of Healthy Community Brookfield's HCB. So the goal of this presentation is for you all to understand HCB's mission and vision, learn about HCB's programs, learn about environmental factors that can possibly impact HCB, take a look at the SWOT analysis I've created for HCB, and identify strategies for HCB's future successes. Here is an overview of HCB's programs and services. HCB is a nonprofit organization. It's a 501(c)(3) under the U.S. Department of Treasury. In 1997, a wealthy donor donated $2 million to HBC, and this is where it officially became a nonprofit organization to expand the mission of health promotion and wellness. The organization is well known for helping the community, and it has a positive environment with the staff involved. Here is an overview of HCB's programs and services. It ranges from women's health to employee health to violence prevention programs, diabetes, vaccine and immunization services. So as you can all see, HCB offers a variety of programs that meets the needs of multiple communities in Brookfield County. There's always room for improvement, and we can also help in the future establish new programs that meet the needs of other populations that are not specifically stated in these programs. But as you can all see, we are off to a good start of having all of these programs and services in HCB. Some environmental factors that impacts HCB is working with the county health department and having the state funding involved, since most of our funding is from the county health department and state funding. It's important to improve the relationship between HCB and stakeholders, because currently HCB's relationship with stakeholders is not as strong as we'd like it to be. Some examples of stakeholders include primary care physicians, local law enforcement, local hospitals, local farmers, and other local agencies. So this impacts HCB because we could have a greater potential working with these stakeholders. Other organizations that impacts HCB are Meals on Wheels, YMCA, YWCA Elder Services, Regional Transportation Services, and the United Way. So these community partnerships impact HCB as well, because some of them kind of don't understand what HCB is about. So oftentimes it can confuse community members about our role in the community. And our community partnerships are expecting us to have a clear mission and vision for HCB, as well as the county health department wants us to meet the accreditation requirements, because if we don't, then funding will be taken away from us. So on this slide, we can see our SWOT analysis. First off, starting strengths, then weaknesses, opportunities, and threats. And the strengths including organization perceived as us doing good. Staff members and organizations have a reputable reputation, and HCB wants to improve the community's health. And our services and programs focuses towards health promotion, wellness practices, and education. Now, like any other organization, HCB does have its weaknesses. A few involve lack of understanding of organization's purpose, The community sometimes cannot differentiate us from other organizations in our programs or services. Our mission vision is unclear to some people, so some stakeholders question the purpose of HCB. Now, these weaknesses, of course, have its potential to turn into strengths, and I feel like with our strategic planning, these weaknesses will not be here any longer. And of course, HCB has opportunities to improve the quality improvement plan, revise the strategic planning initiative, improve partnerships throughout Brookfield County, and expand our programs, like I mentioned before. Some ways our programs and services can expand is incorporating LGBTQA services, suicide prevention services, and so forth. We do have some threats, but one of our biggest threats is the potential funding, because we're not meeting the accreditation requirements. So funding is our biggest threat. However, once we are on track to meet the accreditation requirements, the threats will not, funding will no longer be a threat. So this is our current mission and vision. Our current mission is, as a nonprofit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. Now, I myself proposed a mission, and I kind of rewrote the mission in order to improve HCB's mission. So instead, my statement is Healthy Community Brookfield strives to improve the overall well-being of the community's health by strengthening the quality and performance of health promotion and wellness practice through outreach, provision of services, and ongoing education. I didn't include that the description that HCB is a nonprofit organization, because that's not really important, and what it's important is that we're an organization that we're here to offer services to our community. So the current vision is, as a nonprofit organization, Healthy Community Brookfield promotes health practices which can lead to improved health behaviors, healthier individuals, and health communities. Now, my proposed vision for HCB is that the residents of Brookfield County will be the healthiest in the state by promoting health practices that will lead to healthier behaviors, healthier individuals, and healthier community alongside their community partnerships. This way, we envision Brookfield County as the best county in the state. So my 5-year strategic plan, I have 4 strategies. Strategy 1, establishing an agenda. So this agenda will be the initial part of the strategic planning to be more organized. And this way, we have an agenda that focuses on projects and making changes to those projects. Now, those involved in this would be the board of directors, HCB, and stakeholders and community partnerships. In order for all us to be on the same page of what we want HCB to be and how others can help us get there. Strategy 2 would be HCB and organizations deliver interventions, services, and programs to the community members. And this way, the community will be aware of all the programs and services HCB has to offer. So this is part of the deliver and design. So in order for the community members to know what we are about and what we have to offer, because it doesn't make sense having all these programs and services and none of them being used. So that's why it's important for us to promote it out there. And as well, this will help us with our community members, because they might have some services that we might need to offer, or they can, we can improve each other's programs and services. Now, with that said, strategy 3 is establishing community partnerships. So it's very important to establish community partnerships in order to work together and work on the overall goal of the quality of health and improvement for members of Brookfield County, community members of Brookfield County. Strategy 4 is imperative to always meet the accreditation requirements. The action plan for strategy 1 is to establish an agenda with services and programs. So the way this would be done is we're all meeting for a few weeks in order to do that. Action plan 2 is through social media, newspapers, handout materials, ACB and stakeholders will promote programs and services. Action plan for strategy 3, monthly meetings between HCB and community partnerships to always improve the programs and have that collaboration among each other. Action plan 4 is bi-yearly meetings from HCB, the county health department, and board of directors to make sure HCB is continuing to meet their accreditation requirements. Now, the ways to evaluate effectiveness, we can do it through quantitative goals and metrics. We can also conduct surveys from community members and partnerships in order to see how HCB is doing and seeing if we are meeting the needs of the community. We can also use the agent-based modeling. And lastly, innovation change management tools. So from what we've done in the past, how have we been doing and what changes need to be done for it. And this is the budget. The total budget estimation is roughly $15,000. This breaks down to agenda materials, health promotion materials, monthly meetings, and accreditation requirements. So it's an estimation of $15,000. Overall, this presentation for HCB strives to provide the utmost quality care for Brookfield County, and it all begins here. It all begins with you all, the board of directors' involvement. The way you can help me as executive director is to give me the plans from previous years, budgets from previous years, any financial information from previous years, current year's activities or progress, and any new government policies that can affect us as a nonprofit organization. These are my references. Thank you all for listening to my presentation, and I hope together we can move forward in order for HCB to become one of the greatest organizations for Brookfield County and the state. Thank you.